Hello and welcome to the program. I am Suren. This time I would like to talk to you about another brain-related disease. Dementia. Uncertainties the people experience these days all around the world seem to be going through conditions like brain fog or forgetfulness. Perhaps even some form of escapism on one side. And on the other, many people seem to ask all about the condition which affects almost all people, not the elderly alone. What is dementia? So, I feel that we need to talk about this issue also. Dementia is a terminology for several diseases which affect memory, thinking, and the ability to perform daily activities with humans. This illness gets worse over time. It is thought that the condition mainly affects older people, but not all people will get it as they age. Things that increase the risk of developing dementia include 1. Age. More common in those, say, 65 or older ones. 2. High blood pressure, hypertension. 3. High blood sugar or diabetes. 4. Being overweight or obese. 5. Smoking. 6. Drinking too much alcohol. 7. Being physically inactive. 8. Being socially isolated. 9. Depression. Let us talk about symptoms, causes, and available treatment methods. To start, let us find an answer to this following question. What is dementia really? According to Alzheimer's associations, dementia is a general terminology for loss of memory, language skills, problem solving, and other thinking abilities, which are severe enough to interfere with the daily life. Now, amongst these, Alzheimer's is the most common cause of dementia. We will have to emphasize that dementia is not a single disease. It is a general terminology to describe a collection of symptoms that one may experience if they are living with a variety of diseases, including Alzheimer's. These diseases can be grouped under the general term of dementia and are caused by abnormal changes within the actual brain. Dementia symptoms trigger a decline in thinking skills, forming thoughts, also known as cognitive abilities, and they are severe enough to impair one's daily life and independent functions. They also affect behavior, feelings, emotions, and relationships. Alzheimer's disease, as researched into, accounts for, say, 60 to 80% of cases. One form is known as vascular dementia. This occurs because of macroscopic bleeding and blood vessels blockage in the brain. It is the second most common cause of dementia. It is noted that those who experience the brain changes of multiple types of dementia spontaneously have mixed dementia. There are many other conditions that can cause symptoms of cognitive impairment, but that cannot be classified as dementia, including some that are reversible, such as thyroid problems and certain vitamin deficiencies. Dementia is often incorrectly referred to as senility or senile dementia, particularly with the elderly, which reflects the formerly widespread but incorrect belief that serious mental decline is a normal part of aging. However, it is not. Again, what are the symptoms of dementia? Well, let's look at them once more. The signs of dementia can vary greatly. 1. Short-term memory. 2. Keeping track of one's purse or wallet. 3. Paying bills. 4. Planning and preparing meals. These are just a few of them, and now we can add remembering appointments, traveling out of the neighborhood. Let's not forget that dementia symptoms are progressive, which means that the signs of cognitive impairment start out slowly and gradually get worse as time goes by, leading to actual dementia. If you or someone else you know is experiencing memory difficulties or other changes in thinking skills, do not ignore them. Professional evaluation is a must, as it may detect a treatable condition. Even if symptoms suggest dementia, early diagnosis allows a person to get the maximum benefit from available treatments and provides an opportunity to volunteer for clinical trials or studies. It also provides time to plan for the future. So, what are the causes? Dementia is caused by a variety of diseases that lead to damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, as you can guess, thinking, behavior, and feelings can be adversely affected. The brain has many distinct regions, each of which is responsible for different functions. For example, memory, judgment, and movement. When cells in a particular region are damaged, that region cannot carry out its functions normally. Different types of dementia are associated or related to with particular types of brain cell damage in particular regions of the brain. These are, for example, in Alzheimer's disease, high levels of certain proteins inside and outside brain cells make it hard for brain cells to stay healthy and to communicate with each other as they need to. The brain region called the hippocampus is the center of learning and memory in the brain, and the brain cells in this region are often the first to go, first to be damaged. This is also why memory loss is often one of the earliest symptoms of Alzheimer's. While the most changes in the brain which cause dementia are permanent and worsens over time, thinking and memory problems caused by the following conditions may improve when the condition is treated or addressed properly and promptly. 1. Depression. 2. Medication side effects. 3. Excess use of alcohol. 4. Thyroid problems. 5. Vitamin deficiencies. How is it diagnosed? Well, there is no one test to determine if someone has dementia or not. Healthcare providers or doctors usually diagnose Alzheimer's and other types of dementia based on a careful medical history, a physical examination, laboratory tests, and characteristic changes in thinking, day-to-day functions, and behaviors associated with each type. Medical staff, doctors, professionals can actually determine that a person has dementia with a very high level of certainty. But it is harder to determine the exact type of dementia symptoms because the symptoms and brain changes of different dementia can overlap. In some cases, a doctor may diagnose dementia and not specify a type. If this occurs, it may be necessary to see a specialist such as a neurologist, psychiatrist, psychologist, or even a geriatrician. Let us now consider treatments and care. Treatment of dementia primarily depends on its cause. In a case of most progressive dementia, including Alzheimer's disease, there is no cure at this stage. But two treatments, donanemab or Kisunla and lecanemab or Leqembi, demonstrate that removing beta amyloid, one of the hallmarks of Alzheimer's disease, from the brain reduces cognitive and functional decline in people living with early Alzheimer's. Others can temporarily slow the worsening of the illness or the symptoms thereof and improve quality of life for those living with Alzheimer's and the caregivers, of course. The same medications used to treat Alzheimer's are among the drugs sometimes prescribed to help with the symptoms of other types of dementia. Non-drug therapy can also be used to alleviate some symptoms of dementia. Ultimately, the path to effective and therefore new treatments for dementia is the only way through increased research funding and increased participation in clinical studies. Right now, volunteers are urgently needed everywhere to participate in clinical studies and trials about Alzheimer's and other dementia, all around the world. Let us talk about the dementia risk and prevention methods. Some risk factors for dementia, such as age and genetics, cannot be changed. However, there are scientists and the researchers continue to explore the impact of other risk factors on brain health and prevention of dementia. And here are some of the facts. As one reads, in 2021, 57 million people had dementia worldwide, over 60% of whom live in low and middle-income countries. Almost every year, there are nearly 10 million new cases worldwide. As it is considered before that dementia results from a variety of diseases and injuries that affect the brain. Alzheimer's disease is the most common form of dementia and may contribute to 60 to 70% of cases. Dementia is currently the 7th leading cause of death and one of the major causes of disability and dependence among older people worldwide. In 2019, dementia cost economies globally was approximately 1.3 trillion US dollars. Approximately 50% of these costs were attributable to care provided by informal carers, for example, family members and close friends, who provide an average 5 hours of care and supervision per day. Unfortunately, women are disproportionately affected by dementia, both directly and indirectly. Women experience higher disability-adjusted life years and mortality due to dementia, but also provide about 70% of carer hours for people living with dementia. Dementia has physical, psychological, social, and economic impacts, not only for people living with dementia, but also for their carers, their families, and society at large. There is quite often a lack of awareness and understanding of dementia, resulting in stigmatization and multiple barriers to diagnosis and care. A few words once more about the signs and symptoms. Observable changes in mood and behavior sometimes happen even before memory problems occur. They get worse in time. Eventually, most people with dementia will need others to help them with daily activities. Here again are some of the early signs. 1. Forgetting things or the recent events. 2. Losing or misplacing things. 3. Getting lost when walking or driving. 4. Being confused even in familiar places. 5. Losing track of time. 6. Difficulty solving problems or making decisions. 7. Problems following conversations or trouble finding words. 8. Difficulties performing familiar tasks. 9. Misjudging distances to objects visually. What are some of the common changes in mood and behavior? We might ask. 1. Feeling anxious, sad, or angry about memory loss all the time. 2. Personality changes. 3. Inappropriate behavior patterns. 4. Withdrawal from work or social activities. 5. Being less interested in other people's emotions and feelings. Dementia affects each person in a different way, depending upon the underlying causes, other health conditions, and the person's cognitive functioning before becoming really ill. Most symptoms become worse as time goes by, while others might disappear or only occur in the late stages of dementia. As the disease progresses, the need for help with personal care increases. People with dementia may not be able to recognize family members or friends, develop difficulties moving around, lose control over their bladder and bowels, have trouble eating and drinking, and experience behavior changes such as aggression without any reason that are distressing to the person with dementia as well as those around them. Common forms of dementia. As you may know, repeating, dementia is caused by many different diseases or injuries that directly and indirectly damage the brain. Alzheimer's disease is the most common form and may contribute to 60 to 70% of cases. Apart from vascular dementia, dementia with Lewy bodies, meaning abnormal deposits of protein inside nerve cells, and a group of diseases that contribute to frontal temporal dementia. That is the degeneration of the frontal lobe of the brain. Dementia may also develop after a stroke or in the context of certain infections such as HIV as a result of harmful use of alcohol, repetitive physical injuries to the brain, known as chronic traumatic encephalopathy, or even nutritional deficiencies. The boundaries between different forms of dementia are in distinct and mixed forms, often coexist. As mentioned before, there is no particular cure for dementia, but a lot of them can be supported with both types of people living with the illness and those who care for them. People with dementia can take steps to maintain their quality of life and promote their well-being by 1. Being physically active. 2. Taking part in activities and social interactions that stimulate the brain and maintain daily function. Some medications can help manage dementia symptoms. Cholinesterase inhibitors like donepezil and used to treat Alzheimer's disease, NMDA receptor antagonists like memantine are used for severe Alzheimer's disease and vascular dementia. Medicines to control blood pressure and cholesterol can prevent additional damage to the brain due to vascular dementia. Selective serotonin reuptake inhibitors, or SSRIs, can help with severe symptoms of depression in people living with dementia if lifestyle and social changes do not work. But these should not be the first options. The medical advice provided if the people living with dementia are at risk of hurting themselves or others. Medicines like haloperidol or risperidone can help, but these should never be used as the first treatment. That's important. What about self-care? For those diagnosed with dementia, there are things that can help manage their symptoms. 1. Stay physically active. 2. Eat healthily. 3. Stop smoking and drinking alcohol. 4. Get regular checkups with your doctors. 5. Write down everyday tasks and appointments to help you remember important things. 6. Keep up your hobbies and do things that you enjoy. 7. Try new ways to keep your mind active. 8. Spend time with friends and family and engage in community life. Plan ahead of time. In time, it may be harder to make important decisions for yourself or your finances. Identify people you trust to support you in making decisions and help you communicate your choices. That is, if you have family and friends. Create an advanced plan to tell people what your choices and preferences are for care and support. And bring your ID with your address and emergency contact when leaving the house. Reach out to family if you have any, and friends for help. Talk to people you know about how they can help you. Join a local support group. It is important to recognize that providing care and support for a person living with dementia can be challenging, impacting the carer's own health and well-being also. As someone supporting a person living with dementia, reach out to family members, friends, and professionals for help. Take regular breaks and look after yourself. Try stress management techniques such as mindfulness-based exercises and seek professional help and guidance if needed. What about the risk factors and prevention? Although age is the strongest known risk factor for dementia, it is not an inevitable consequence of biological aging. Furthermore, dementia does not exclusively affect only the older people. Young onset dementia, defined as the onset of symptoms before the age of 65 years, accounts for up to 9% of cases. Study shows that people can reduce their risk of cognitive decline and dementia by being physically active, not smoking, avoiding harmful use of alcohol, controlling their weight, eating a healthy diet, and maintaining healthy blood pressure, cholesterol, and blood sugar levels. Additional risk factors include depression, social isolation, low educational attainment, cognitive inactivity, and air pollution, plastics, and so forth. Human rights issues, an important area to consider. Alas, people living with dementia are frequently denied the basic rights and freedoms available to others in some parts of the world. In many countries, physical and chemical restraints are used extensively in care homes for older people and in acute care settings, even when regulations are in place to uphold the rights of people to freedom and choice. An appropriate and supportive legislative environment based on internationally accepted human rights standards is definitely required to ensure the highest quality of care for people with dementia and their carers. What is the very best thing to assist dementia? Organize quiet times into the day, along with certain activities. Keep well-loved objects and photographs around the house to help the person feel more secure. Remind that person who you are if he or she doesn't remember. But try not to say, "Don't you remember?" Encourage always to a conversation for as long as possible. Now, That is a very good advice. Question: what are the things to never do with your loved one who may be having dementia? That's a very good question, an important one. Don't tell them they are wrong about something. Never argue with them. Don't ask if they remember something. Don't remind them that they are the partners of, or parent, or other loved one is dead. Don't bring up topics that may upset them. Here is another question, and it has to be asked. What are the 3 golden rules of dementia? We spoke about it some time ago. Don't ask direct questions. Listen to the person and learn from them. Don't contradict. Hopefully these points can help, and with that we shall end this episode for now. Keep smiling and be happy. Wishing you always well. Thank you.